Hello, I am Dr. Siddhartha Mani, consultant interventional cardiologist at RN Tagore Hospital, Kolkata. So today I will be discussing in short about hypertension, covering its major aspects. See, hypertension is basically elevated blood pressure, and it is divided into two types mainly: systolic hypertension and diastolic hypertension. If you go by the blood pressure, if the higher blood pressure, that is, we denote a blood pressure suppose by 120 by 80 like that, and if the upper value is increased, we call it a systolic hypertension. If the lower value is increased, we call it a diastolic hypertension. And there can be a elevation of both the systolic and diastolic value. There can be an elevation of the systolic value only, that particularly occurs in the elderly people, which we call isolated systolic hypertension. In the young people, we sometimes have only elevation of the diastolic value, which we call isolated diastolic hypertension. And another classification of the hypertension is based on its value. If it is less than 140 by 90, we call it normal. More than 140 by 90, we gradually classify it as hypertension stage 1 up to 160 by 100, then hypertension stage 2 up to 180 by 110, and if it is more than 180 by 110, we call it a stage 3 hypertension, or sometimes resistant hypertension, based on certain other factors. And if you go by the etiology, we divide hypertension into primary or essential hypertension, where we do not find an exact cause behind the hypertension. That is basically familial, to some extent gene influenced, and no other secondary cause is found in such cases. And in the secondary hypertension, which accounts for around 10% of the cases, we have secondary causes like thyroid hormone problems, like corticosteroids hormone problem, adrenal problems. Sometimes we have renal artery or kidney disease. So there are so many causes. I won't go into the details. Now, how to diagnose this condition is obviously by measuring blood pressure, which is mostly done in the clinic by the doctor or the paramedical staffs. Now, there are certain points which are to be noted during this measurement of blood pressure. And frankly speaking, these are not followed in most of the centers because of our busy OPDs. So the patient has to rest for 30 minutes before measuring blood pressure. The patient should sit comfortably without crossed legs. The hand where you are measuring the BP should be placed comfortably on a table, supported. It has to be at the level of the heart. And then the speed of inflating the cuff, the speed of deflating it. There are so many parameters to be looked into, which the physicians are aware of, but sometimes because of the busy schedule, it is not possible. So nowadays, we stress much more on home recording of blood pressure or ambulatory blood pressure monitoring, which can be done out of the clinic. So the patient will measure his or her BP in the home itself, and we will make an average of certain values over 7 days, or there will be an ABPM machine attached to the arm, which will keep measuring the blood pressure every 30 minutes throughout the day, and we will average out the BP and find out whether the patient is having systolic or diastolic hypertension. Now, this is important because only one single recording does not always portray the exact physiological abnormality that is going on inside. The patient may be in stress, the patient may be anxious, the patient may have come to your chamber in a hurry, or the patient may have smoked 5 minutes back. So this can influence your blood pressure in the chamber and can falsely lead to a diagnosis of hypertension. So this is very important for the common people as well as the physicians to understand that your measurement should be accurate and should be an average of several recordings. So that is a very important aspect of diagnosis. And then obviously hypertension is a very, very morbid disease. It can lead to different complications. It can add on to morbidity and mortality. And currently, as you know, that across the world, India is gradually becoming the capital, the cardiovascular disease capital of the world. And many such cases are caused by elevated blood pressure or hypertension. And it accounts for for almost 50-60% of the cardiovascular disease burden. And the more important or the more fearful picture is most of such cases are not properly recorded, not properly diagnosed. Nearly 60% of the patients suffering from hypertension are not yet diagnosed. So the patients do not know their diagnosis, and even much less percentage out of those, they are being adequately treated. So it's not about prescribing a molecule and then forgetting it. It has to be adequately followed up, adequately treated. Otherwise, hypertension will lead to renal compromise, kidney diseases. It will lead to heart failure. It will lead to hypertrophy. It will lead to heart attacks. It can lead to very deadly complication, that is strokes, hemorrhagic or ischemic strokes. So there can be deadly consequences of this hypertension, and accordingly, it has to be urgently diagnosed and treated. Its diagnosis I have already discussed in a nutshell. We also do some basic investigations like ECG, echocardiography, some blood parameters, because many a times we find hypertension co-associated with diabetes, dyslipidemia, thyroid abnormalities. So only treating hypertension will not suffice. You have to treat those comorbidities as well. Now, coming in short about the management, very important is lifestyle management, your diet, your salt restriction, your fat restriction, and obviously some exercises which you need to do, like we recommend 30 minutes or up to 30 to 45 minutes of regular walk at least 5 days a week. So these are the lifestyle changes you need to do. And then comes the cessation of smoking habits, cessation of alcohol, cessation of other addictions, and obviously reducing obesity is very important. Then we come to drugs. There are so many drugs. Broadly, we have the angiotensin receptor blockers or the ACE inhibitors, like the commonly prescribed telmisartan, olmesartan, those group of drugs. And out of them, telmisartan is most commonly prescribed because it has enough ample evidence of benefit, mortality and morbidity benefit in heart failure, in post-MI situation, in coronary artery disease. So probably telmisartan is one of the most commonly prescribed drugs. And then we have other groups like the calcium channel blockers, the amlodipine, the cilnidipine recently, because amlodipine has some problem of pedal edema, which can be taken care by the other groups like cilnidipine or benidipine group of molecules, which has some renal protection as well. So these are some of the things, and beta blockers obviously was initially preferred, but nowadays beta blockers is not included in the first line management. Obviously, it is used as an add-on in certain resistant cases. So obviously that will bring us to the last part, that is resistant hypertension. There are certain cases where after using 3 or more group of antihypertensive molecules, we are still unable to control the blood pressure. And such cases are called resistant hypertension, where we need obviously to treat much more aggressively with some modern therapies, like we have renal denervation nowadays, we have some baroreceptor stimulation therapies, we have certain sympathectomy, surgical procedures to reduce the blood pressure, to reduce the sympathetic tone. And we have many second or third line drugs like the plozasins, the clonidines, the alpha-1 receptor blockers. We can use those molecules, but obviously this is not an over-the-counter drug. So you need to consult cardiologists and you have to undergo many investigations before you prescribe or you go to those second or third line drugs, because they also have many side effects. So this is all about hypertension in a very short nutshell, but the ultimate message is you have to diagnose hypertension very early, you have to treat it very early, and then obviously you can prevent many complications. Thank you.